because this releases happy hormones, the joy hormones, which were secreted when we carry out physical activity. We don't like to, struggle with our patients, but that can be very helpful in terms of their activity and make you be more active, and an impact on the psychological factor rather than staying isolated at home. Sometimes to be able to join different groups that carry out yoga, for example, and there are other people who are going through similar treatment and who carry out exercise, and that if you join them, this really into your moving around aspect. So it has to, all of this is very balancing. All this is difficult with all your day-to-day activities at home, and to keep yourself in shape. The treatment are very difficult, and it's necessary that you be able to continue to go your activities. So this is, more and more happens. I mentioned that all of these activities that can be not exactly spiritual, but to carry out meditation, things that are mind activity, try and generate positive thoughts. And I also give an example that for some people, for example, it would be to go take a walk in the woods. This is good for my body, but it's very good to focus on something else. Meditation, reading poetry, for example. All of these aspects are very important, and to face up to fatigue. So sometimes we have to focus our concentration elsewhere than on our body, on the surgery and on the disease, to go beyond, for example, listening to classical music or to jazz, and in this environment, we are more distant from the unpleasant realities. So I just would like to say that in the health area, we need to come back to the physical aspect and the mental aspect. There are centers here in Canada that try to combine the alternative approaches in respect to herbal therapies and things like that. I think you should always ask your main care provider before you start using them, because there can be interactions with your other medication, and it can do more harm than good sometimes. Sometimes we are in an environment that are against other approaches. We know that they exist, but people need to be prudent. A good approach is to, with this disease, it is not only medical, the treatment is important, but we have to maintain contact with our friends. If you went bowling, continue to go bowling maybe not more than once a week, but reduce the activity, but unless your energy levels are too low, if your system can't take it, but to try and maintain your activity as close as possible to what it was before, and that will help. I think I've forgotten a point. I mentioned in the medical world in 2006, there was a big conference in the United States where there were a number of presentations for patients who are on fatigue with chemotherapy patients. So scientifically speaking, there's going to be a conference which is called for those who are involved, like physiotherapists, for example, people who are involved in treating cancer. It's just like a training that is available from the 20th to the 25th of July. All of this to tell you that we're trying to help you, not be just with medication, and not just with psychology, but also with, for example, injections that can stimulate red blood cell, that can stimulate the immune system, and help with your treatments, and also to help you keep your energy at the highest level possible so you can have a pleasant life. This is what we try and do. And what I've tried to explain throughout all the different phases and at a higher or lower level. Thank you very much. I'm going to turn the floor over to Dr. Provencher for her presentation. Good afternoon, everybody. The subject that I've been asked to deal with in the English, we call it chemo brain. In French, there's no actual translation for it. What we're talking about is the clouding of brain function. And this is a concern that is very legitimate. We see it quite often, and there's a lot of controversy. Perhaps a more scientific term, which goes to the effect of mild cognitive impairment in English. This is a low level of cognitive defect. This is a term which is evolving. I think we'll be able to define it in the end. But I'd like to show you on the scientific level, we'll be able to understand that there is a problem and to see what are the, objectively speaking, what is this syndrome, and also to be able to look for paths to solutions. If we look at the literature, not something that's been dealt with for any length of time. There's a Dr. Peterson who started to study these problems, and initially, a very broad definition was a mild cognitive defect, difference between the normal process and function of age, and what we see. So you see there's a very large area that would come under this definition. It's where there's some difficulty is that most of these studies have done with patients with breast cancer, and for ovarian cancer, there have been a few studies for people with lymphomas as well. So we see this is still in its infancy, and we're trying to define this syndrome. There was a very important workshop with 30 participants who were very interested in this area. This was in April 2003 in Banff, and this was put together by a group, Hurricane Voices Medical Foundation, and there were patients who wanted to help people who were suffering from breast cancer. There were oncologists, radiologists, pathologists. There are also investigators and basic researchers, and there were people who represented the patients to discuss this problem. And in this workshop, we came to the conclusion that this is a real problem and that we have to define it properly